Hi everyone, I'm Kristen Presall. Welcome to this edition of Medical Monday. We're glad you tuned in tonight. We're going to be talking about something that's very timely because it is summertime. A lot of people outside enjoying the beautiful weather. Not so much today, it's pretty hot out there. But if you're one of the folks who gets out every day and you don't wear something to protect your skin, you could be in trouble down the road. Let's face it, I'm a child of the 70s and 80s, and I will say, you know, my parents didn't necessarily put as much suntan lotion on us. We weren't as protected as I think parents nowadays protect their children. And it's a good thing because, you know, when we're exposed in our younger years, definitely in our middle-aged years and even older, we can find spots and, you know, something that might look like a freckle that's a little bit raised. You need to go to your dermatologist and find out, is this something more? That's what we're going to be talking about tonight, is we're going to be talking about skin cancer awareness and any type of way to prevent it. We, of course, have an expert on tonight. You're not going to just be talking to me, thank goodness, or I would tell you a lot about my childhood and the fact that I was not protected. But we have a guest, as I mentioned, Ronald Nelson, Dr. Ronald Nelson. He is associated with Middle Tennessee Medical Center. You can call him Junior, although I will call him Dr. Nelson because that is what he is, a dermatologist from the area. And we are glad to have you on today. Thanks so much for being here.
No, thank you.
We need to mention also that Dr. Nelson just opened up his new clinic, and that's Stones River Dermatology. Can you tell us where that is?
We're located at 1608 Williams Drive in Murfreesboro, and we just opened our new facility today in our new building.
Terrific.
So it's right near the campus of Middle Tennessee Medical Center.
Yeah, and you help a lot of people with situations of any kind, of course, you know, skin problems. But when we're talking specifically about skin cancer, there are several different kinds of skin cancer out there. The one that's, I think, most well known to a lot of the viewers out there is probably melanoma.
Yes, ma'am.
Because it is considered probably the dangerous kind.
That's correct. It's the most deadly type of skin cancer. It's responsible for about 75% of all deaths that occur from skin cancer are due to melanoma skin cancer.
Goodness.
It's the type that can spread all over the body and be very, very aggressive. And
has melanoma ever spread to organs? If it
Yes.
Okay.
Yes, ma'am. It has the potential to spread from the skin to other organs in the body, the brain, the heart, lungs. It can spread to many, many organs, and it can spread very rapidly if it's not caught early.
Sure. You know, I was just mentioning, obviously, in the very beginning of the show of, you know, how kids, even nowadays, wear more hats, you know, the rash guard shirts, which are great, you know, if you're going out to the pool, different things like that, just to protect your skin from any kind of damaging rays. But when would you say people should start getting their skin checked by a dermatologist? I mean, at what age? Teenage years or earlier?
Well, the American Academy of Dermatology recommends that anyone should, with risk factors, which means lots of moles, family history of skin cancer, personal history of skin cancer, should be examined at least once a year after the age of about 20. And I certainly would concur with that recommendation. It's never really too soon if you have something suspicious to come on in and get it checked out.
Sure.
So I wouldn't necessarily wait for a magic number of age 35 to be checked out if you've got a suspicious place. Okay. I personally, in my practice, have diagnosed melanoma in a young lady that was the age of 22. So it's not unusual for that sort of thing to happen now.
Okay.
And so if someone has a spot, they need to get it checked out regardless of what age.
Absolutely. Dr. Nelson, what causes melanoma?
It's caused by ultraviolet exposure, sun exposure.
Okay.
Is basically what causes it. As you know, all skin cancers are caused by ultraviolet and sun exposure. There are some other risk factors as well, such as genetics, you know, family history, and those type of genetic syndromes are fortunately very rare. They're not that common, but some people are genetically predisposed to the development of skin cancer and development of melanoma. And there are some other issues with that too. Other types of skin cancer can be caused by certain chemical exposures as well as sun exposure, as well as ultraviolet exposure.
Yeah,
So
and I guess don't think for a minute that even if the place where you find some sort of skin cancer isn't exposed to the sun doesn't mean that you can't get it on maybe the back of your neck or you know, along your waistline or something like that. And I know that seems so weird, but certain places that are even covered, you can still get some sort of skin cancer.
That's absolutely correct, and that's something that, again, we don't fully understand all the reasons why people develop melanoma.
Sure.
But for the most part, the biggest risk factor is still, I should say, the biggest controllable risk factor, because we can't obviously change our genetics, but certainly the biggest controllable risk factor is ultraviolet exposure, sun exposure.
Okay.
And most of that sun exposure occurs, as you mentioned, when you're a child.
Yeah, small. What are some of the symptoms people should look for, specifically regarding melanoma, when you're doing any kind of scan? Maybe you're a mom looking at your child, or a wife looking at your husband. What are you looking for specifically?
Specifically, what you're looking for on a self-examination is the four criteria, the A, B, C, D criteria, and then also there's the E that a lot of people send in. But the A stands for asymmetry. And that means one half of the mole doesn't look like the other half. You cut the mole in half and they just don't look, one half doesn't look the same. That's potentially a problem.
Okay.
B would stand for border irregularity, whereas you may have a very, very smooth border, but then it's got an arm sticking out of it.
Oh, I see. Okay.
And then C stands for color variation. And that refers to a mole that may have several different colors. It may be red, black, brown, tan, even blue, or even white, all in the same mole.
Oh, wow.
Now, you can have a brown homogeneous mole that may be one color brown. You may have another one that's tan. The two of them by themselves are okay, but if they're two of them, two colors together in the same mole, or three colors in the same mole, that's the concern with the color. And then D refers to diameter greater than 6 millimeters, which is about that of a pencil eraser or a pen cap.
Okay. So something more than that, you've got to really.
And then those are the things that you look for. And then obviously too, I always tell patients that I get to see kind of a snapshot of what goes on that day, and a mole may be totally normal to my exam, but if it's evolving, which is the E, if it's changing, if it's growing, if it's bleeding, that's something to be concerned about. And if that sort of thing is happening, that oftentimes trumps all those others. You may have a mole that looks totally fine, but if it's new and growing rapidly, that still deserves evaluation and biopsy.
Okay, now I was told this, and for all the ladies out there, you may have been told this too. I have a mole on the bottom of my foot, and I told my doctor, I said,
yes, ma'am.
Ever since I had my second child, it looks bigger. And I was told sometimes moles, when you're pregnant, do evolve.
That's correct.
They do change.
They do.
So should you still be nervous about something like that and get it checked out, or do you just say, well, that could be because I was pregnant?
That's correct, and that's still a difficult issue, not only for the person that's looking at that mole, wondering if it's a problem, but also for dermatologists and physicians too, because moles do oftentimes change during pregnancy. The criteria, however, I think for diagnosis should still be the same. If there's a suspicious mole, even if someone's pregnant, it's still a suspicious mole and
Sure.
needs to be evaluated and treated as a suspicious mole. The concern being that melanomas can also develop in pregnancy regardless of whether you're pregnant or not. You can still develop melanoma.
Interesting. Okay.
And so it is important to have those evaluated, and if they are changing, if they're growing, and then get them treated just like any other mole.
And how are these spots diagnosed?
Primarily it's by either a dermatologist or a primary care physician will evaluate the mole and do a biopsy. It's the moles are and abnormal moles are still a diagnosis of melanoma is by looking at it under the microscope to get establish that pathology.
Sure.
And so that's something that at the present time there are some treatments that are invasively improving our ability to diagnose abnormal moles, but still the gold standard is to remove a portion of the mole and have that looked at under the microscope. That's still the gold standard approach.
Yeah. Okay, very good. We are talking again with Dr. Ronald Nelson, Jr. If you would like to call and ask him a question, he's a dermatologist down in Murfreesboro. Feel free to do that. You can call 737 plus is our number. We have open lines right now. We'd love to hear from you, so if you have a question, call in now. We'll be right back.